I'm back. So now we're going to talk about other bacterial diseases of the cardiovascular system. So we'll start with tularemia. Tularemia is a disease that was first found in Tulare, and this is in California. It's a county in California. That's why it has this name. And the name of the bacterium is Francisella tularensis. Okay, so that's a gram-negative bacterium. And this is a zoonotic disease. Look at this little rabbit here. So this is what happens. It can be caused by an animal, or it can be caused by inhalation of the bacterium in dust. Okay, so this is what usually happens. You have ticks or insects such as deer flies. So that's the deer fly. And this is the tick, right? And they can transmit the bacteria from a rabbit or a small mammal to us. And in our body, when the ticks bite us, let me show you the cycle. Oh, I don't have the cycle here. It's a different cycle. Okay, I don't have the cycle, but it's a simple cycle. When they bite us, that tick can develop into adult and produce eggs, and those eggs have the Francisella bacterium, and they can spread more to other animals, and then the animals can, we can get, again, the tick from the animals, and it keeps going in a cycle. Okay, so we get the tick that beat the animal, and the disease was in the animal. The disease can also, the bacteria, Francisella, can also be in the soil, and then when you're like cutting grass, you know, you can get in contact with that dust, and that dust has the bacterium. Okay. So when it's caused by the bite of a deer fly or a tick, you usually have an ulcer in the site of entry. Okay, so that is the one that causes a really bad ulcer, and the bacteria can enter and infect phagocytes, and that's what causes enlargement of regional lymph nodes. Okay, this type of tularemia that is through the skin has only a 3% mortality, but the one that is caused by inhalation can have around 30% mortality if it's untreated. Okay, so that's the most severe one. It can also be caused by ingestion, and then you call oropharyngeal, and then it infects the oropharynx. Okay, but the pneumonic one, the one that causes pneumonia through the respiratory system, that's the most serious one. Okay, the lesions in the skin from the bite and the deer fly bites, from the tick and deer fly bites, can also, the bacteria can migrate through the lung through the blood to the lung and cause pneumonia. Okay, so have that clear too. One way, one form can be transformed into another. That's why these diseases are complicated, right? So this is between 2005 and 2015. Most of the cases of tularemia were in that region, and here you have the Midwest, Southwest, and this is like Missouri and Arkansas. These are the worst states. Okay, we're kind of happy here. We don't have many cases. So there is a case study here. Let's see. A woman has fever, 5 days, hospitalized, drop in blood pressure, aggressive treatment with fluid and massive antibiotic doses don't solve the problem, and she dies 5 days after. Bacteria that was found was catalase negative, gram-positive cocci. You see, coccus, round, gram-positive, purple, with the gram stain. That was isolated from her blood. What bacterium could cause this infection? So I want you to think. So we were talking about sepsis in the first video, right? So we're going back to it here in this case. So I want you to think, if they're catalase negative, they cannot be Staphylococcus aureus. So you exclude that. So then what would be the suspicions here? Streptococcus, because it's in the blood, right? So either streptococcus or enterococcus. Okay? So how would you know between those two? Streptococcus, remember how they grow as little chains? That's not what you see here. Here you see more like clusters, right? And enterococcus can grow as clusters. So this is likely enterococcus that causes septic shock. So that's a gram-positive septic shock. Okay, so just to get you a little more accustomed to looking at case studies, I just wanted to show you this one. Brucellosis. Brucellosis is also gram-negative coccobacilli, grow in phagocytes. So they grow in phagocytes because the phagocytes can kill them. They are resistant to that digestion. This bacteria is transmitted via raw milk from infected animals or direct contact with the animals. Okay, so it affects what we call the reticuloendothelial system, which is where the macrophages are, right? All the phagocytes. So it's part of the immune system and affects the phagocytes. So it makes the immune system compromised because your phagocytes are compromised, right? But it's not usually fatal, okay? Anthrax. That's another disease that can come from animals, okay? Bacillus anthracis is the name of the etiological agent. Gram-positive, forms endospore, and it's aerobic, okay? So these bacteria are found in the soil. Usually grazing animals are the ones that get them primarily, so they need to be vaccinated. And so they kind of keep the bacteria, if they're not vaccinated, they just keep spreading the bacteria into the soil, right? To other neighborhoods, to other areas where the spore was not present, and then they spread. So think about this. When the bacterium is on the soil, it's in the form of endospores. When it gets into the cattle body, that is warm, full of nutrients, and wet. So they become vegetative cells again. And that's when they proliferate. The endospores don't proliferate, but the vegetative form does. And then the bacteria can spread it to you or spread back to the soil, and then you can contract it through in contact with the animal or the soil. Okay? These bacteria, when they enter the bloodstream, they can release toxins, and this causes, it's the 20% of the cases of this disease are fatal. Okay? This bacteria is not contagious, but if you have contact with discharges from cutaneous anthrax or, with direct contact with the lesions, you can get infected. Usually you get it by breathing in the spores or eating undercooked meat or drinking water that is contaminated with the spores or getting spore through the skin in a cut, for example. The name of the toxin that is produced by anthrax is edema toxin. That's one of them. That's what causes local swelling and interfere with the macrophages with phagocytosis. And then there is another one called lethal toxin that targets and kills the macrophages. Okay? There is an amino acid capsule for anthrax bacteria, the Bacillus anthracis, that they can evade the immune response through this capsule. So 3 forms of this disease: the cutaneous, right, when you have a minor cut and they go through there; the gastrointestinal, when you ingest the undercooked meat; or the pulmonary, when you inhale the endospores from the soil in dust particles. This is 100% mortality. So this is the most severe one, followed by the gastrointestinal, followed by the cutaneous. Remember when we studied ID50, there was an example with the toxin that causes anthrax, and it said the ID50 is much lower for the inhalational. So you don't need to inhale too many spores. I think around 20 to 50 endospores are enough to make you sick. So where do you see this happening? You have a lot of endospores forming and surviving in areas of permafrost. So for example, in Antarctica, in frozen soil, if scientists go there to dig for resources and they can get in touch, for example, with the anthrax endospores and get infected. Okay. Okay, next one, gas gangrene. Gangrene, the terminology, what the meaning of the word is death of soft tissue, versus necrosis, which is a general name for death of tissue. Okay, so what causes the death of soft tissue? It's the low influx of blood to that tissue, so the blood is sending oxygen and nutrients. When there is loss of that blood, you can have gangrene. Okay, so how does that happen? What happens here is that, for example, if you have an exposure, an open fracture in a bone, okay, or you have a wound that gets contaminated, a septic abortion that was not done with with aseptic technique, a roadside accident that can lead to open fractures. All these are situations where you can get Clostridium perfringens. Okay, these bacterium can also be present in food, but that's a different type of disease, and we're going to talk about that in the digestive system diseases. Okay, so how does this work? Once the bacterium gets in your body through the skin, they start growing in the tissue. So remember, they're anaerobes. I'm going to write here because I think it is here. Anaerobic rod. Okay? So because they're anaerobe, they only thrive if they're really deep in the tissue. Okay? If they're if they're close to air, they're going to die. So when they're deep in the tissue, they thrive, and they start to produce these toxins, and they start to move along the muscle fibers. As they are growing, these bacterium ferment also, and they can produce a gas. This gas kind of makes like pressure in the tissue, and that kind of stops the blood flow to that tissue. No blood flow, no oxygen. The bacteria like that there is no oxygen, so they grow more. So this is one of the main ways that the bacteria thrive, and in a short period of time can cause a lesion to look this ugly. Okay, it becomes blackened. The skin becomes blackened because of hyaluronidase. Hyaluronidase breaks down the connective tissue between the muscle and spreads the bacterium. Okay, so why is hyperbaric chamber is so important in this type of to stop or to treat this type of disease? Remember, hyperbaric chambers, you have oxygen as the treating vehicle. Oxygen kills an anaerobic rod. So when you use a chamber with a lot of oxygen, they die, and that's a way to treat it. Okay. Okay, so there are some diseases that are caused by animal bites and animal scratch. And one that we're going to focus on is the cat scratch disease. This disease is caused by Bartonella henselae, and this bacterium is aerobic and gram-negative. They live in red blood cells in the cat, and then that cat gets bit by fleas, right? And then in the flea, they multiply in the digestive system of these fleas, and when the flea defecates, they bite and defecate on, let's say, human skin. That feces gets, like, you eat it, and they get into your body. Okay? So it can be because the flea bit you, or because the feces of the flea is in the cat's nail. So that's how you can get it. Mostly it's through the scratch. Okay? So the cat has dirty nails with feces of the fleas that is in its body. The flea has Bartonella, the flea feces. And when they scratch your skin and make a wound, that feces contaminate the wound, and you can get this disease. It forms a papule in the site of the infection, And then when it moves to the lymphatic system, it causes the lymph nodes to swell. Okay? Fever, malaise. It's self-limiting. Usually it heals by itself. Alright, so now let's talk about plague. There are some case studies here, and I think I put some tips underneath, so if you want to discuss them with me later, I'm open to it. Plague is very serious. It is very controlled nowadays because we have good sanitary system. But before people understood that not being sanitary could cause very serious diseases, plague was a disease that would spread really quickly. So if you think about the 1800s, the 600 years, you had a lot of this type of disease causing and being endemic and causing epidemics in different areas. Okay, so Yersinia pestis is a gram-negative rod. The rat flea has this Yersinia, right? So that's where they grow. And then the flea bites in hosts like rat and humans is what transmits the disease. So the flea can transmit the disease from a rat to you. If you are in a city where there's no sanitation, where sewers are open and rats move everywhere and they can come close to your food and close to you, that's when the fleas come, right? Because they kind of follow the animals. And then you can get beat with that flea and get sick. So when the bacteria enters the bloodstream, it usually proliferates in lymphatic tissue, causing what is called buboes, which are intense swelling of the lymph nodes. So the bubonic plague, which is the most common, can cause 50 to 75% mortality, depending on if it's not treated, right? So that's the bubonic plague. You see how there is one of the signs is the swollen lymph nodes. So it's caused by the bite of an infected flea. And it can spread to other parts of the body, so the bubonic plague can become septicemic. The septicemic can also happen by itself without really needing to start as bubonic, but the bacteria is present in the blood in this case, and you have septic shock as a result. Also resulting from bites of infected flea or handling infected animals. Okay. The tissue may turn black and die, especially on tips of fingers, toes, and the nose. You can also have the pneumonic plague. The pneumonic plague, it has near 100% mortality rate. So when you think about what happened in the past when they caused very large epidemics, they were caused by the pneumonic plague. So the bacteria grows from you inhaling infectious droplets that are transmitted from people, and then they grow in the lung. They spread really easily through that way. So that was the transmission human to human. And they could be treated with antimicrobial drugs. But in that time, in the 1800s, they didn't have drugs. So it was a huge epidemic in many areas that end up as a pandemic. And it killed 1/4 of the world population. So it was a very serious deal, even though nowadays you rarely find plague in the United States. If you look at the map, look, it's like you have maximum 24 cases in very limited areas. Okay? Over 80% of the United States cases are bubonic form. See if there's anything else here. It happens to people in all ages, even though 50% of the cases occurs in people ages between 12 and 45 years old. Okay? More common in men, probably because of increased outdoor activities that put them at higher risk. Lyme. Lyme disease is caused by Borrelia burgdorferi, and this bacterium thrives and multiplies in tick. So it's a tick-borne disease. And you probably heard about this before, right? So field mice are the most common reservoir, but the disease cycle doesn't close unless you have a deer in the cycle. So I'm going to show you how this happens. So they're spirochetes, right? They move through corkscrew movement. Before I show you the cycle, let's talk about symptoms. So typical symptoms of this Lyme disease include fever, headache, fatigue. There is a very characteristic skin rash that is called erythema migrans, or bull's eye rash, which looks like this. Okay, so in the first phase you can have this type of rash. In the second phase you can have irregular heartbeat because they move through your cardiovascular system to the heart, encephalitis, facial paralysis, and memory loss. And when they're from the second to the third phase, it's a lot harder to find an effective treatment. But you can have also arthritis due to an immune response in the third phase. To prevent Lyme disease, the only way or the best way is to use insect repellent and that remove ticks, and use clothes that have pesticides and reduce clothes that have insecticides, repellent, or applying pesticides in the fields to reduce the tick habitat. Okay. So this is the cycle for the Lyme disease. It starts with a little baby larva. So this is the tick that has the Borrelia, the bacterium, and they infect mice, right? In this baby larva in the mouse is dormant, and then they grow in specific seasons. So usually in the spring, you see how the color code here for green is spring. In the spring, the larva develops into an 8-legged nymph. The nymph can infect other animals and humans. The nymph transmit the Borrelia to us. But think about it. That nymph was a baby, right, in the previous spring. And then on this spring, they grew enough that they can come and infect you. They're not dormant anymore. During the summer, these nymphs bite deers. In the deer is the only host that can, where the ticks can have sexual reproduction. And then they lay eggs. The females lay eggs, and you have more little baby larvae. So this is the cycle. So you understand that without the sexual reproduction in the deer, the disease doesn't continue. So one of the ways is avoiding areas where there are deers that you know that could be endemic for Lyme, where you could get bit by these ticks. Okay? There is no evidence that Lyme disease is transmitted from person to person. Even although dogs and cats can get Lyme disease, there's no evidence that they also can spread this disease to the owners. But pets can bring ticks to your yard, and in that way you could get Lyme disease. Okay, so they're not a direct transmitter, but they can bring the ticks. If you don't use tick killer in your animals, okay? Okay. Typhus. Typhus is caused by rickettsia, and we're going to focus on the tick-borne typhus, which is the Rocky Mountain spotted fever disease. It's caused by Rickettsia rickettsii. This is usually spread by wood ticks and dog ticks. Okay, it causes a measles-like rash, and that appears usually on palms and soles and face. the mortality rate without early diagnosis of typhus is approximately 20%. These bacteria grow inside the endothelial cells of the vascular system. Okay, so they're obligate parasites. And as they block, because the endothelial cells are inflamed, they block blood vessels, and that's what causes a worsening of the disease. It's important to notice that different types of tick can cause Rocky Mountain spotted fever. And the early symptoms are very general and non-specific, but then the disease can rapidly progress to a more serious and life-threatening condition. And symptoms can include fever, headache, rash, nausea, vomiting, stomach pain, muscle pain, and lack of appetite. Usually you don't have chronic disease, but some patients who don't recover from Rocky Mountain spotted fever can have permanent damage, and that can include amputation of arms, legs, fingers, and toes. Think about it. All your blood vessels are committed, right, if the disease is not treated. From that damage, you can end up having to cut a limb. Hearing loss, paralysis, mental disability. But this permanent damage is caused by the acute illness. You don't have chronic infection, okay? So it's important always to treat clothes and equipment that you're using in the woods with permethrin that avoids ticks, okay? Boots, use clothes that cover your skin so you avoid having contact with those ticks. Usually the cases for Rocky Mountain are more on the East Coast, okay? In states like North Carolina, Tennessee, Missouri, Arkansas, and Oklahoma are the ones that are more prone to get the cases of this disease. The cycle is very similar to the one I showed you for Francisella tularensis, where the tick bites, the tick lays the eggs hatch, develop the larva bites small mammals. The small mammals can transmit the tick to us, and then in our body, they can, after they bite us, they can develop into the adult tick, and the adult tick, after bites us, can also, you know, if you're infected with the Borrelia, with the rickettsia, sorry, those ticks can lay eggs that are going to be infected with the rickettsia and transmit to other people and to other animals, and then you close the cycle. Okay? Viral diseases of the cardiovascular system in the next video. I'll see you soon. Bye.